EA 2186, or the GIANT study as we call it, focused on older adults with metastatic pancreatic cancer who were over the age of 70, had an ECOG performance status of 0 to 2, but also were vulnerable based on our screening geriatric assessment. So they had to have some kind of vulnerability either in function, cognition, or in comorbidities. In addition, if they were over the age of 80, they were considered vulnerable and allowed on the trial. And the study randomized them to 2 dose-attenuated treatments with gemcitabine and nab-paclitaxel, or 5-FU and liposomal irinotecan, both with a dose attenuation as would be fit for that patient population. We followed these patients until disease progression and evaluated them for overall survival, progression-free survival, response rate, and quality of life aspects. What the study showed is that overall there was no difference between the 2 arms. Both regimens performed about the same, but the survival was quite poor, and these vulnerable patients didn't do very well. The median overall survival was around 4 to 5 months. We actually looked a little bit deeper and realized that a significant percentage of patients were not able to start therapy, and that was because they progressed or their condition deteriorated before they could actually start the treatment, which is why we did a separate analysis only on those patients that were able to receive the therapy. And for them, the survival was about 8 months, which would be what we would expect from these regimens. So this led us to think about what's happening with these patients, and really is it a matter of understanding who could benefit from treatment? And we started to analyze factors that could contribute to that. We're starting this comprehensive analysis of all the geriatric factors, and some of them already show strong correlation with outcomes. In addition, quality of life measures at baseline strongly correlate with outcomes. This makes us think that we could potentially come up with a nomogram or an assessment tool that will be able to select those patients who can truly benefit and hopefully enable us to help patients decide whether they want to go through these treatment, talk to patients about prognosis, or maybe even support them so we can get them to treatment.